On this episode of Putting Possibility into Practice, you've heard the news, and now meet our new Chief Medical Officer. Dr. Geeta Nayyar joins us on our podcast. We'll talk bridging clinical medicine, business, and health information technology. What it all means for providers who partner with Greenway. And winter is coming. We're talking about life outside of work. She's a huge fan of the television show Game of Thrones. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and welcome to this episode of Putting Possibility into Practice. If you are a returning listener, thank you once again for tuning in. And if you are a new listener, we are glad you found us on your podcast platform of choice. I invite you to subscribe on your platform of choice. We'll have more of those platforms later on in this podcast. On this episode, I am delighted to be joined by Greenway Health's new Chief Medical Officer, Dr. Geeta Nayyar, who was named among top 26 smartest people in health IT by Becker's Hospital Review and ranked as one of the top 25 minority executives in healthcare by Modern Healthcare. She's also a huge fan of Game of Thrones, which we will get into later on. And I have to be honest, I've never seen an episode myself. But anyhow, I want to welcome Dr. Nayyar to the podcast. Thanks for joining me.
Joe, thanks so much for having me.
First of all, let's give the listeners who have seen the news across our social media and perhaps visited our website to read the press release recently when we made the announcement, a little bit background about yourself, where you grew up and where you are now.
Sure. Well, I am a proud Miami Hurricane. I went to college and medical school at the University of Miami, and I grew up in a medical family near the Stewart area. So I'm a very proud Floridian and really proud to be working for a Florida-based company.
And what made you get into healthcare? Where did the interest come from?
Sure. Well, again, I said I come from a medical family, so everyone in my household was always talking shop of some sort. But truly, I just I find science fascinating. I find the human body just phenomenal. So I've just always been someone who loved science and medicine and wasn't really a lab nerd, couldn't really see myself in research or as a PhD, so medicine just felt like the natural fit. And
how about moving into healthcare IT? How'd that come about?
Like all good things in life, completely by accident. I was actually at George Washington University where I did my fellowship and my residency, and we were implementing our EMR for the first time, and I just sort of connected the dots and thought it was a phenomenal technology that just really needed a clinical lens, and got really involved in that implementation and rollout and the product, and I really never looked back since. And
what made you have an interest in joining the team here at Greenway Health?
Oh my goodness, so many things. Well, first and foremost is that Greenway is a leader in the health technology space. The executive team just truly phenomenal, and their commitment to everything in patient safety, compliance, innovation was so compelling, and I couldn't ask for a better opportunity. So I'm really jazzed to be here.
And how can providers who partner with Greenway benefit from Greenway Health having a chief medical officer? Not something we've had in the past.
Sure. I think the role just complements everything else that Greenway is bringing to the table. And I think truly it's the commitment that the company has to bringing the end user into the product development, the strategy, the implementation. My role is to really be the end user's voice in everything that we do. So I think this role is a true commitment. It's a new role for the company and one that just speaks to the broader commitment to our customers.
And speaking of the end user, you recently presented at a patient experience summit in Cleveland, Ohio through the Cleveland Clinic and HIMSS on Don't Forget the End User. What was that all about?
Sure. I think just too often in the health tech industry or technology in general, we tend to build really cool things because we can, but we forget the problem we're actually solving for. And physicians, clinicians, we really like simple stuff. We don't like a lot of alerts. We don't like to have to click 30 times for something. And just because we can do something doesn't mean necessarily we should. So, I think that's really what the presentation was about, what the conference was about, and how you really do couple the soft human skills with technology, and that there really is a fine balance.
And speaking of being an end user and a provider, little bit for those who may not realize it, you still have a practice over in Miami, correct? And what specialties?
Sure, I do. So I'm a rheumatologist by training. I do internal medicine and rheumatology, and I'm on faculty at both FIU and University of Miami. So I see patients there and get to teach a little bit, and it's a great balance for me. And again, Greenway is very supportive of that, so I'm very appreciative of that.
And, speaking as a chief medical officer and also a provider yourself, what are some of the biggest challenges facing healthcare providers today?
I think it's indicative of where the whole industry's at. It's just being asked to do more with less. So it's being asked to see more patients with less time. It's being asked to do more paperwork, less clinical time. It's trying to do value-based medicine in a still fee-for-service model. There are so many pulls on the average doc today, and there's just not a lot of tools for providers to succeed, and there's just not a lot of know-how or experience. Again, all of us went to medical school to be doctors, but, increasingly the administrative side is getting to be quite burdensome. And I think therein lies the opportunity that we have with Greenway and with my role, and to just figure out where those synergies are and how we can best help our customers where we can to be successful in present-day medicine as well as future-day medicine. And
let's talk about some of the honors I mentioned in the intro. So one of the top, I'm just a social media guy, but you're one of the top 26 smartest people in health IT by Becker's Hospital Review. What's it mean to be recognized by such an industry-leading publication like that as to what sounds like a great list to be on?
Oh, my gosh. I mean, I think it's incredibly humbling. I don't know who the other 25 were, but, I think there's so many smart people in the industry. I think I'm one of many, and I have so many mentors and colleagues that I've really learned from, continue to learn from. And, I think the space is just, it's just perfectly full of opportunity for people who are smart and willing to work hard and also willing to listen, because I think you get into trouble when you think you know everything. And I think that's half the battle is recognizing that so much of what we're doing in the industry is new. As we talk about AI, predictive analytics, there's so much that we know, and there's so much more that we have to learn, and I'm just really humbled to be recognized for that and to be in the company of so many people that I continue to learn from. And
another leading industry publication, Modern Healthcare, naming you one of the top 25 minority executives in healthcare. And what does it mean to be not only on that list, but a minority executive in the healthcare industry?
I guess I don't really think about it, to be honest. I mean, again, I think that there's so much opportunity for executives that bring value to the table, and I think it's wonderful that publications like that recognize so many folks that are doing good things in the industry. I will say that I personally, for obvious reasons, I think women in technology are underrepresented, and there's an area that we can work on in that space. And I think not just because it's the right thing to do, but because, again, when we talk about the end user, in the household, there's so many studies that show us that the decision maker in the household for healthcare decisions is Dr. Mom. It's mom that takes the kids to the pediatrician. It's the spouse that takes the husband to the doc. It's the mom or the female caretaker that's taking care of elderly parents. So I think in that regard, it's really important because so much of what we're doing affects the woman in the household. And I think having women at the top representing what the end user wants to get from a patient and caretaker perspective is really important. So I'm very privileged and feel that that's important. Also, as a true doctor, Dr. Mom, who does also take my daughter to the pediatrician, I definitely have plenty of use cases and areas where I give my opinion, solicited or unsolicited, at our pediatrician's office.
I know. I grew up in a medical family. My dad practiced dentistry for 38 years. My uncle, at a little over 80 years old, is still practicing internal medicine. And my mother, from being around my dad so long, they've been married now 40 years, seems to have that medical inclination just about still to this day. Anytime I go get checked out for something, I think I answer more questions from her than I do the actual doc when I'm in the office. So I can understand that Dr. Mom perspective. And talking about that Dr. Mom perspective, so a chief medical officer, you're on the board, you have your own practice. Life outside of work. Is there such a thing? And what's life outside of work like for you? What do you enjoy doing?
Sure. No, well, first of all, I have a 7-year-old daughter that keeps me busy and keeps me on my toes. So definitely everything and anything related to her. I love tennis. I'm a big tennis fan. I play pretty regularly, and I love Game of Thrones. I got to tell you, this is the last season. I don't know what I will do with myself after the show ends. I'm going to have to go actually read all the books now.
Yeah, and I was going to close out our podcast talking about that. It seems it's a huge rating success, and it's all over social media. And I mean, I'll be 100% honest. I have never seen an episode of Game of Thrones. Everything I know of about Game of Thrones come from either what I see on my Facebook feed or on my Twitter feed. And as a huge New York Mets baseball fan, what Noah Syndergaard, who's one of their pitchers, posts about Game of Thrones, and I think he's even been a cameo on a couple episodes. But what got you into Game of Thrones, and just talk about that a little bit. And then you'd mentioned your 7-year-old daughter, but isn't there a connection between Game of Thrones and your daughter too?
Well, it's so funny you asked me that. I think you must have picked that up from somewhere. Yes, so shortly after my daughter was born, our family, we started watching Game of Thrones, and there's a particular character called Arya, and Arya happens to also be an Indian name, and Sonia was maybe 6 or 9 months old, and I remember turning to her dad and saying, I think we should change her name. We should change her name from Sonia to Arya. And then believe me, I still might do it, even though she's 7. She's just such an awesome kind of heroine in the show, but you got to watch it, Joe. I mean, you got to watch it. You got to stop what you're doing. You got to stop the podcast and go turn it on. It's just such a cool science fiction story, and people think it's it's not about any special effects or that it kind of takes place in this medieval sort of time, but it's really about people. I mean, it's really about humans, human nature, and it's a very thought-provoking show, which is what I really enjoy about it. And there is some science and some fantasy, so the science nerd in me really just enjoys it. But it's quite a phenomenon. Our whole family.
Yeah, no, I've heard that and seen that, and certainly once The Walking Dead runs its course on TV, perhaps I'll go back and catch up on all the past seasons of Game of Thrones, because as you mentioned, it wraps up. This is the last season, correct?
It is, until they come up with something new. I've heard that they're going to be doing a prequel, because this will be the end. So we'll see. Summer is coming, so I guess I'm going to have to find something else to do. But summer is coming.
Indeed.
It's about to end.
We'll keep you busy here at Greenway, so we should be all set by the time Game of Thrones wraps up.
That's right.
Well, I want to thank you for taking time out of your always busy day to join me on this episode. I hope that our listeners learned a little bit more about you, life outside of work, and what you're going to bring to the team here in Greenway, and how providers can benefit from having your expertise on board. So thank you for sharing some of the thoughts and taking time out of your day to join me on our podcast.
For sure. Thank you so much, Joe, for having me. I appreciate it. And whenever you want to watch, you let me know.
I will. And once again, that's Dr. Geeta Nayyar. She is the new Chief Medical Officer at Greenway Health. I thank her for her time here on our Putting Possibility into Practice podcast. A reminder, you can catch up on all our past episodes in between a Game of Thrones or whatever else you watch on TV. You can visit our website at www.greenwayhealth.com to catch up on our past episodes of our podcast. And I do invite you to subscribe to our podcast on your platform of choice, and we are on a number of them now. We are on Apple iTunes, Google Play Podcasts, TuneIn Radio, iHeartRadio, Stitcher, Spotify, SoundCloud, Libsyn, FM.Player, and look for more podcast platforms coming soon. Once again, I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thanks for listening.